Hi, it's Phil.
Hi, I'm Esther.
So we're here today to talk about whether your toes burn. So we get a lot of patients who'll come in and they'll say, I've got burning in my toes. So I know we both have seen patients even in the last few days with this symptom. So Esther, what is the number one most common reason that people will get a burning sensation in their toes in that area?
So the most common condition, it's called Morton's neuroma. That's the reason why people would tend to get burning pain in their toes.
Yeah.
Yep.
There are heaps of other conditions as well, but definitely the neuroma, the thickened swollen nerve in between the toes there, is definitely the most common reason. So as you can see here, actually a little bit hard to see. I'll see if I can zoom it in. There we go, that's easier. So you can see there so these are the toes, obviously, and these are the metatarsals, so this is in the foot. But between these metatarsals, there's a nerve that passes between each space. And a neuroma is a long-term thickening of that nerve. So it doesn't take weeks or months, it takes decades to develop. It's a long-term thickening of the nerve and the tissue around the nerve. So what it looks like is this, all right? So you can see that there, so that's showing a swelling or an inflammation. And that the nerve should be, to give you an example, the nerve should be about the same thickness as the end of this pen, the actual metal part just at the end, the pointy bit. But a neuroma, once it's really developed, actually ends up about the same thickness as this end. So 4 to 5 millimeters, it's not uncommon to have a thickening like that. So the most common way it presents is you'll get an aching, burning sensation in that part of the foot, and then it can also shoot up into the toes. So the most common toes we normally would see is the third and the fourth toes will burn, because if that one there is pinched, it'll go up to those two toes. Yeah. Now there are other things that could cause it, things like diabetes and other neurological conditions, but yeah, neuromas, that's the most common cause. So, Esther, what is the first thing that you do when someone comes in with neuromas? What's the first sort of treatment that we look at initially?
Yep. So I will look at their footwear. Some people's shoes might be a bit too tight around the width of their feet, so around this area.
The front.
So, yeah,
the forefoot, yeah.
Yeah, so an easy fix would be just to have them being in shoes that have a wider fit, have a broader, forefoot area.
For sure.
Box. Yeah.
So, high-heeled shoes with a tight toe box for ladies is often a common cause. Yeah. And even for men as well, I mean, things like footy boots or even work boots or steel cap boots that are just a bit too narrow at the front. And if you've got a wider foot, you need to look at a shoe with an extra width fitting 4E or whatever you can get. And for some people that really helps. That's enough to solve the problem. It won't get rid of the thickened nerve because that's still there, but it will stop it getting squeezed and becoming really painful. Now if that helps a bit but not enough, we've got lots of other treatments we can do. Probably the next thing we look at is we'll look at the way your foot is working. And we need to make sure that your foot is not behaving in a way that's going to put excessive tissue stress through the lesser metatarsals. So that's a big mouthful, but basically if your foot is collapsing inwards and then when you go to push off, if the big toe joint isn't working right, you'll actually get too much pressure through the outside here. So we will look at all of that. So we use video gate analysis, so you got 3D scanner to sort of scan your foot and work out what's going on, because we like to use orthotic therapy for long-term cases of neuromas that won't get better, and they help a lot of people as well. We can do little additions too to the orthotics, a little metatarsal domes. So lots of things we can do. There are other hands-on treatments we can do, things like dry needling, and we can refer for injection therapies as well, things like cortisone or ethyl alcohol injections. They're all things we can do if we need to, but we start easy and then get more complicated and expensive as we go along, as we need to. Yeah, so if you have burning toes, you should come and see us anyway, so we can work out if it's a neuroma, and if it is, we can definitely help with that. If it's not, we can also work out what else is going on, because all we do is look at feet all day.
Yeah.
That's all we do. We get up in the morning, we come and look at feet and fix them, and then we go home. So
brings us joy.
Brings us joy.
Yeah.
Sounds strange,
yeah.
but it's great.
Yeah.
The thing about sore feet is if your feet hurt, it just makes life so miserable. So we enjoy
helping people fix their foot pain.
Fix their foot pain, and they can get back to life doing the things they want to do and need to do. So if that's you, we'd love to meet you. Thank you for watching.
Thank you.
See you again.
See you.